Good morning everyone. Now we are discussing about the lateral compartment of the leg. The lateral compartment of the leg is also called the peroneal compartment of leg. The boundary of the peroneal compartment medially by the peroneal surface of the fibula and laterally by the deep fascia of the leg and anteriorly by the anterior intermuscular septum and the posteriorly the posterior intermuscular septum. Then the content of the peroneal compartment is the muscle, the peroneus longus muscle and the peroneus brevis muscle. The peroneus longus and the peroneus brevis. Then the nerve is the superficial peroneal nerve and the vessels, the peroneal branch of the posterior tibial vessels. These vessels come in the lateral compartment by piercing the flexor hallucis longus and the posterior intermuscular septum. And the vein of this compartment is the short saphenous vein. Then come to the individual muscle, the peroneus longus muscle and the peroneus brevis muscle. The peroneus longus muscle take its origin from the upper two-thirds of the peroneal surface of the fibula. Then also along with this the intermuscular septum. Then this peroneus longus muscle descend downwards and form a tendon. The tendon situated just laterally to the lateral malleolus, and here it passes through the superior peroneal retinaculum. The superior peroneal retinaculum is a fibrous band, and this is the condensation of the deep fascia of the leg, and this is situated from the lateral malleolus to the calcaneum bone, and passes through the superior peroneal retinaculum the peroneus longus muscle covered with the synovial sheath. Then this muscle descend downward. See this picture, the peroneus longus muscle, the tendon of the peroneus longus. It is the laterally and behind the lateral malleolus, and then it descend downward through the superior peroneal retinaculum and downward and forward, and it is present below the peroneal trochlea of the calcaneum and descend downward and forward, and this part, when the lateral part of the cuboid bone, this tendon change its direction toward the medial and forward. See this picture, the tendon of the peroneus longus changes direction and through the plantar surface, and there form a osteofibrotic tunnel through the cuboid bone, and then it goes toward the inferomedial part of the base of the first metatarsal bone and along with the medial cuneiform bone. This is the insertion of the peroneus longus tendon. The action through this route, the peroneus longus also passes through the superior peroneal retinaculum, also a inferior peroneal retinaculum. Through this inferior peroneal retinaculum, the sheath divides and also covered with a synovial sheath. So there are two retinaculum, the superior peroneal retinaculum and the inferior peroneal retinaculum. The function of the retinaculum is these two retinaculum plaster this tendon in its position. So the origin, then the muscle present, then the tendon and the insertion of the muscle. The function of the muscle, the peroneus longus muscle is a everter of the foot, and this is also a plantar flexor. Then it maintains the lateral longitudinal arch and the transverse arch of the foot. Okay, then the peroneus brevis muscle. The peroneus brevis muscle takes its origin from the lower two-thirds of the peroneal surface of the fibula. Then it descends downward, and the peroneus brevis muscle is beneath the peroneus longus muscle. Then this muscle descend downward and form a tendon. The tendon present the lateral and the behind of the lateral malleolus, and this tendon is closer to the bone. Then this tendon goes toward the downward and forward, and through the superior peroneal retinaculum and inferior peroneal retinaculum. In its course, through the superior peroneal retinaculum, it's along the tendon of the peroneus brevis, present along the tendon of the peroneus tertius and covered with a synovial sheath. Then the tendon of the peroneus brevis descends downward and forward and passes through the inferior peroneal retinaculum just above the peroneal trochlea of the calcaneum. Then it descends downward and forward in attached or inserted to the base of the fifth metatarsal bone. Then the function of the peroneus brevis. The function of the peroneus brevis, it is also everter and plantar flexor of the foot. Okay, then the nerve. The nerve of the lateral compartment is the superficial peroneal nerve. The superficial peroneal nerve takes its origin from the common peroneal nerve just lateral to the neck of the fibula. Then it present beneath the peroneus longus and descend downward, and when it descend downward, then it present beneath the peroneus longus and peroneus brevis and supplies these two muscle. Then it descend gradually downwards, and then this muscle pierces the deep fascia at the upper 1/3 and lower 1/3, the junction of the upper 2/3 and the lower 1/3 of the leg. And this nerve divided into lateral and medial branch and supply the most of the skin of the dorsum. Thank you.